A very good afternoon, everyone. So today we will be discussing regarding the awareness of World Cancer, which is very, very important because breast cancer and cervical cancer are the very two important topics which we will be discussing. To my extreme left is Dr. Shreya Mollik, consultant medical oncologist. And to my immediate left is Dr. Shoma Dotto, consultant gynecologist and obstetrician. Both are associated with Woodlands Hospital. So good afternoon, everyone. So first, I need to start off with Dr. Mollik. So how common is the breast cancer amongst women worldwide and in India?
Breast cancer is the most common cancer in females worldwide as well as in India. And in India, it is the most common cause of death due to cancer. And approximately 2 lakh cases of new breast cancer cases are diagnosed every year in India.
So, what are the risk factors which are associated with the breast cancer?
So, there are multiple risk factors. Firstly, some of the factors are modifiable, some of the factors are non-modifiable. So, the modifiable risk factors are definitely increasing age of the female is a definitely risk factor. Obesity, BMI is if more than 30, it is a risk factor. It's a use of hormone, OCP, hormone replacement therapy, and there is increase of the endogenous estrogen like lack of breastfeeding and late childbirth, early menarche, late menopause. And other risk factor are, there is familial risk factor, how many first degree relative, how many second degree relative are associated with breast cancer, and there is also a genetic risk factor, that is mutation of the BRCA gene. And another very important risk factor is if any young female, if diagnosed with any other cancer and received radiotherapy in the chest area, she may develop breast cancer in later half of her life.
Okay, so what are the typical symptoms of breast cancer and how would you make your patient aware of it?
So the breast cancer, there are typical some sign and symptom. First is the lump in the breast that is to be identified by the patient. It may be associated with pain or it may be painless. The size of the lump will be increasing in the due course, and there is overall change in size and shape of the breast, and there may be associated with skin changes over the breast like redness, thickening of the skin, ulceration of the skin, and there is nipple changes like nipple retraction, bloody discharge from the nipple, or there may be swelling in the armpit. These are the warning sign of breast cancer.
Right. So, Dr. Mollik, it's been said that early detection does improve the outcome of breast cancer. Can you please throw some light on it?
Yeah, definitely. Breast cancer is a preventable disease. So, if we can diagnose the breast cancer in early stage, and we can give the treatment in the timely treatment, so definitely it can be prevented, because there are mainly two factors. If the patient can be diagnosed in early stage, there is less treatment, less intensive treatment is indicated. Maybe surgery will be enough to cure the disease, and definitely the cost of therapy will be less and overall treatment outcome will be better.
So what are the screening methods for breast cancer?
So screening is some test or clinical examination by which we can detect the cancer in very early stage before the symptom arises.
Right.
So for the breast cancer, there are mainly 3 types of screening. First is the self-breast examination, where the patient or any lady can examine their breast at an irregular interval. So for that, the lady has to be aware about the sign and symptom of the breast cancer. Second is the clinical breast examination, where she can take a help of any medical professional to examine her breast at a regular interval. Third is the mammography. So if we follow the international guideline, there is indication of yearly mammography after the age of 45. But in the Indian scenario, we at least advise at least a baseline mammogram at the age of 45 to 50 and to be repeated every 2 yearly.
So the last question, what are the treatment options of breast cancer?
So as far as any cancer is concerned, there is multimodality treatment option. There is option of surgery, radiation, chemotherapy, and the supportive treatment. So, and the treatment depend upon the stage which has been detected with the cancer. So, if the patient is detected in very early stage, surgery is enough. But as the cancer increases with the stage, so maybe chemotherapy is required before surgery to reduce the size of the tumor. Then we can proceed for the treatment, chemotherapy, and radiation may be required after the surgery or the chemotherapy.
Very nicely described and very crisply said by Dr. Malik that early detection is the key and we can definitely treat breast cancer. Now coming to Dr. Dotto, cancer in women, cervical cancer is very, very important. So what is cervical cancer and how is you treat the cervical cancers in India? What are the causes of cervical cancer in India?
Cervical cancer is cancer in the cervix. Now what is cervix? Cervix is the lowermost part of the uterus, and any abnormal growth of the cell in that area which destroys the normal cells of the cervix, that causes the cervical cancer. Now there are multiple risk factors for cervical cancer. Few risk factors are early marriage, multiple sexual partner, then unhygienic menstrual hygiene, and smoking. These are some of the risk factors, and it has been found that human papilloma virus, that is one of the major important organelle, the virus is a causative factor of cervical cancer. It has been found that almost 90-95% of cancer cervix has been caused by this human papilloma virus. In India, the incidence is almost as high as 14.9%, 14.9 per 1 lakh population of women.
Wow, that is a fact which is being said by Dr. Dotto, and it is really, really alarming. So, what is the risk factor of the cervical cancer?
As I have already told, the risk factors are mainly early marriage, smoking, and multiple sexual partner, unhygienic menstrual.
So, what are the symptoms you deal with in carcinoma cervix?
Carcinoma cervix presents to us as irregular menstrual bleeding, bleeding after intercourse. It can be foul-smelling vaginal discharge. These are mainly the causes. Sometimes in advanced stage, the patient may come to us with back pain, but that is mostly the neglected cases.
So what is your advice to your patients? Is it preventable?
Cervical cancer is very much preventable. So what are the steps to prevention of cervical cancer? As I have already told, cervical cancer is caused by a virus, the human papilloma virus. Nowadays, there is a vaccine, you all have heard about it, that is a vaccine against human papilloma virus. 2-3 brands are available in the market, and recommendation is to take this vaccine from 9 to 14 years of age, 2 doses, and beyond 14 years of age, 3 doses. This is recommended all over the world, and so for all the young women, between the girls, our girls from 9 to 14 years, the vaccine is recommended. Even beyond 14 years, we are giving this vaccine, and our association like FOXY is recommending this vaccine for women till 14 years of age. But the vaccine doesn't only prevent the cervical cancer. Along with that, we need to go for screening, which will prevent the cancer cervix at its early stage. Actually, one good thing about cancer cervix is cancer cervix has a precancerous stage, and this precancerous stage remains in the body for almost 5 to 10 years, and then it proceeds to cancer cervix. So if we can detect the lesion at the precancerous stage, then we can prevent the disease. So how to detect that precancerous stage? We will detect the precancerous stage by pap smear and detection of high-risk human papilloma virus in the cervicovaginal sphere. And this pap smear for India, it is recommended beyond 30 years of age. Every woman should go for a pap smear and high-risk human papilloma virus testing every 5 years. So jointly, if we do the vaccination and the pap smear, and if we follow this regime, cancer cervix will be preventable, and it can be prevented. So please follow this vaccination and the pap smear rule.
Very nice described. So early detection and early detection can definitely prevent cervical cancer, and also the role of this vaccine is important. So thank you so much Dr. Malik and Dr. Dotto for your valuable inputs. Hope you will definitely be very, very important in hearing this important discussion. Thank you so much.
Thank you.